Hello, I am Dr. Hala Shauki. I start the MRCOG course, and today I will explain the Popq. Scenario could come like this in the exam, where domains will be communication with a colleague, applied knowledge, and patient safety. And your colleague could be ST1 or GB, and he will request from you to give him information about the Popq system. Tasks could include to explain significance of the Popq system in the assessment and the management of pelvic organ prolapse, and to describe how the Popq system is used to systematically grade the severity of pelvic organ prolapse, and you will be requested to answer your colleagues' concerns. You will be provided by some props like jar and speculum. You will be provided by Popq demonstration diagrams in order to give them the diagnosis and the treatment. Popq is a pelvic organ quantification system and used to describe the severity of pelvic organ prolapse, and it is recommended by IOJA International Urogyn Association. The advantage: it objectively assesses the type and the degree of the prolapse instead of subjective assessment, which increase intra and inter-observer variation. It defines exactly where the defect is located and whether anterior compartment, middle, or apical compartment. They don't use terms like rectocele or cystocele, so they do not mention the name of the organ in the prolapse. And it will help in dealing with the prolapse with proper surgery. Example, avoiding unnecessary surgery, choosing conservative versus surgical management. Popq is good in noting of the outcome of the surgery and help in communication of the findings, which is important to continuity care between the clinicians. We will start by explanation of the compartments, and the pelvic organ supports are divided into 3 compartments: anterior, middle, and posterior compartment. Then proceed into explanation of the points. We have 6 points and 3 measurements. All are measured from the hymen. So the hymen is the reference point, and all are measured during the Valsalva's maneuver except the total vaginal length. All points above the hymen will be negative, below hymen will be positive, at the level of the hymen will be 0. And another notice is the posterior vaginal wall is longer than the anterior vaginal wall by around 2 cm. And we have in this diagram the bladder in the anterior compartment, the vagina in the middle compartment, and the rectum in the posterior compartment. And we have here the points of the Popq demonstrated on the diagram. Here we have the grid. We have here in the grid 9 points put in 3 by 3 table. In the upper row, we have 3 points demonstrating the anterior wall, and here in the lowermost row is a point demonstrating the posterior wall, and in the middle we have the measurements including genital hiatus, perineal body, and total vaginal length. Points A anterior and B anterior demonstrate anterior wall prolapse. A posterior, B posterior demonstrate posterior wall prolapse. Point C and D demonstrate the apical prolapse. And genital hiatus and perineal body demonstrate how much strong is the perineal pelvic floor support and the need for repair or no. Let's start by demonstration of the points. And the first point is point AA. And basically it is on the anterior vaginal wall. Here on the anterior vaginal wall, 3 cm proximal to the hymen. So it will be 3 cm, so around here, point AA. And because it is above the hymen, it will be minus 3. Point A, range of values could be minus 3 cm to plus 3 cm. So it is like a fixed point. And when the prolapse occur, it could be here, down here, could be here. Maximum, it will appear plus 3 cm outside the hymen. So range of movement for point A anterior is minus 3 until plus 3. Same applies to the A posterior point, which lies on the posterior vaginal wall 3 cm proximal to the hymen. Here is the hymen, and here 3 cm proximal to the hymen, A posterior, and the range of movement minus 3 cm to plus 3 cm. Minus 3, so if the prolapse happened, this point can come here, here, could be here outside the hymen, up to 3 cm outside the hymen. So range of movement could be -3 to +3. Coming to the point B anterior, which lie in the most distal position of the remaining upper anterior vaginal wall. So point BA lies here on the remaining part of the anterior vaginal wall. It is not fixed, could be at any point according to the degree of the prolapsed part. So the prolapsed point in the remaining part of the anterior vaginal wall could be here, or could be here, could be anywhere along this part. So it is not fixed. The normal position for BA to be above -3. And the range of movement could be between -3 to plus total vaginal length. So suppose if this point prolapsed, it will come here. And if this point prolapsed, it will be here. If this point prolapsed, it will come here. Maximum range will be, and the most distal point is total vaginal length. So range of movement is between -3 cm to total plus total vaginal length. Same applies to the point B posterior, which is the most distal position of the remaining upper posterior vaginal wall. So it lies between the point A posterior on the remaining part of the posterior vaginal wall, and it could be anywhere on this part. Here lies the point BB, B posterior. Also, it is not fixed, it could be anywhere. And depending upon the prolapsed part, the maximum point of the prolapse outside the hymen, it will be -3 to plus total vaginal length. Coming to point C, which is the most distal edge of the cervix or vaginal cuff scar. So this is the cervix, this is the most distal, let's say this point, so it is point C. This point will correspond also to the vaginal cuff scar if there is hysterectomy and we are evaluating for vault prolapse. Let's summarize again the points of the Popq system. Point A1, anterior vaginal wall 3 cm proximal to the hymen, and the range of values between -3 cm to +3 cm. Now let's demonstrate the point D, which is the posterior fornix, which is here, point D, and it is not applicable if there is hysterectomy, and it will be replaced by point C for vault position. The next point will be the genital hiatus and the perineal body measurements. Genital hiatus will be from mid-urethral point, from external urethral meatus to the fourchette, from here to here. So normally it is between 2 to 3 cm. And the perineal body from the fourchette to the midpoint of the anal canal, and it is between 3 to 5 cm. And we put here in the grid genital hiatus, and here is the perineal body. Remaining will be total vaginal length. Total vaginal length will be, after reducing all the prolapse inside without Valsalva's maneuver, we will measure the distance between the hymen to the posterior fornix, and usually it is equal to point D if there is no prolapse. Let's summarize again the points of the Popq system. Point A1, anterior vaginal wall 3 cm proximal to the hymen, and the range of values between -3 cm to +3 cm. Total vaginal length. Point C, which is the most distal edge of the cervix or vaginal cuff. Point D, posterior fornix, and not applicable if post-hysterectomy. Point A, posterior vaginal wall 3 cm proximal to the hymen, range of movement between -3 to +3 cm. And BB, which is the most distal position of the remaining upper posterior vaginal wall, and range of movement position between -3 cm to plus total vaginal length. Again, all measurements are taken while the patient is in lithotomy position with the maximum Valsalva's maneuver or maximum straining, except the total vaginal length, which we measure after we reduce the prolapse inside and without any Valsalva's maneuver. Now, how can we measure? First, explain to the patient take her consent and the presence of a chaperone empty the bladder under aseptic technique. We will use instruments including seams speculum and graduated IOD pusher or ring forceps. Before the patient strain, we will reduce the prolapse inside and measure the total vaginal length. Before the patient strain, we will introduce the graduated ring until it reaches the pouch of the douglas, and then we will measure from here until the fourchette, and usually total vaginal length equals 10 to 11 cm. At the same time, we will mark the point A anterior and the B posterior, which is minus 3 cm above the hymen by the pen. So we will know their new position after the patient strain. We will record the total vaginal length on the grid. Again, all points above the hymen will be by minus and all points below the hymen will be by plus. Now we will start the measurement, ask the patient to strain, and some prolapse will happen. Measure both point C and D. Point C will be from the hymen to the distal point of the cervix, point D from the hymen to the posterior fornix or the douglas of pouch, and then we will put both point D and point C on the corresponding parts of the grid. Point D value, it will be omitted in hysterectomy. It will differentiate between pelvic organ prolapse and prolapse of the ligaments, which are uterosacral and cardinal ligament. Also differentiate between prolapse and cervical elongation. And when point C is descending and the point D in the place, this is called elongation of the cervix. If both points are in the same place, in place, this is considered as prolapse. Now we will measure the anterior wall. We will put speculum, seams speculum, depress the posterior vaginal wall. Ask the patient to push, and we will measure the point AA. Point AA, if you remember, we marked before the patient starts straining. The point A could, after straining, could descend here or here, or could be here at the hymen, or could be below the hymen, and the maximum descent will be by plus 3, from minus 3 to plus 3. We will record the new position of the point AA, let's say plus 3, and we will record here on the grid. Now we need to measure point B, which is normally it is 3 cm above the hymen. So here, point BA, this is a normal position. We will measure after straining. After straining, we will measure the most distal part of the prolapsed anterior vaginal wall. And it could be here, or more down, or even here. Example, if it is plus 4, we will just record here on the anterior, on this part, plus 4. Now we will measure the posterior wall. We will just move the seams speculum and press the anterior vaginal wall. Then use the ruler to measure first the AB point. If you remember, we marked it before on the posterior vaginal wall. We will record the new position and put on the grid. So we will put here and then measure point BB, which is the most distal point on the posterior vaginal wall after straining. We will record here on the grid. Then by the ruler, we will measure, remove the speculum, ask the patient to strain and then measure the distance between, and measure the genital hiatus from mid-urethra to the posterior fourchette, record on the grid, genital hiatus, and from the posterior fourchette to the midpoint of the anus to measure the perineal body, and it will be 3 to 5 cm and record here on the grid. Now we will put all measurements we got on the 3x3 table or on the grid, and here the anterior wall with the points A anterior and B posterior and the cervix. C. The second will be the genital hiatus, the middle row will be the genital hiatus, perineal body and total vaginal length, and the last row will be for the posterior wall, point AB, BB, and the posterior fornix, which is the point D. Now let's summarize how we measure the prolapse. First, position. Patient should be in left lateral position or dorsal lysotomy position at the end of the couch. Before we start the measurement, we need to take consent in the presence of chaperone, empty bladder aseptic technique ready by instruments. We will identify the hymenal remnants and this would be 0 point. We will reduce the prolapse fully and measure the distance of the cuff or the posterior fornix from the hymen, and this will be the total vaginal length. And we will record the total vaginal length here in its position on the grid. Now we will insert the Siemens speculum and depress the posterior vaginal wall and ask the patient to push. Use the ruler to measure the points AA, BA, and C. And then we will record on the grid, on the top part of the grid, which represents the anterior wall prolapse, points AA, BA, and point C, which is the apical compartment. Turn the speculum and press the anterior vaginal wall and ask the patient to push and use the ruler to measure the points AB, BB, and D, which represents the posterior wall and apical compartment BA, BB, and D. We will record on the grid in the lower row. We will take the speculum out and measure genital hiatus and perineal body after the patient strain, and we will record on their place on the grid, which is in the middle row. We will ask the patient to stand and bear down again and confirm the descent of the prolapse in relation to the hymen. Now ask the patient to stand and bear down and confirm the descent of the prolapse in relation to the hymen, and record all results on the grid. And now you can demonstrate the stage of the prolapse, anterior, posterior, or apical prolapse. Now, stages of prolapse. We have 5 stages for prolapse. Stage 0, when all points are above -3. Point C and D will be below or equal to the total vaginal length -2 cm. Stage 1, when 0 criteria are not met and the leading edge is still less than 1 cm. Like here in this diagram. Here is the leading edge and it is above -1 from the hymen. When the leading point come between or equal -1 above the hymen to +1 below the hymen and including the point, this is called stage 3. When the leading point pass the +1 below the hymen but not exceed total vaginal length -2, we call it stage 3. And stage 4, when the leading point come more than plus total vaginal length -2. Again, the another diagram demonstrating the staging. Here, stage 0, when all the criteria are met, and stage 1, when the 0 criteria are not met, and leading point still above 1 cm, -1 cm. Between and including -1 +1, it is stage 2. And stage 3, when leading point exceed +1, but still below the total vaginal length -2, and stage 4, when the leading point exceed total vaginal length -2. Let's apply on some examples. Case 1. When we look at the grid, first we need to know what is the total vaginal length. Here it is 8. We will see what is the total vaginal length -2. Here it equals 6. Now we will look at the points. Point A is -3. Point BA is -3. So both point AA and AB are in stage 0, which is above -3. When we have a look at the AB, A posterior, it is +2, which means it is beyond +1 from the vaginal, from the hymen, which means stage 3 prolapse. Point BB is +5, which exceeded the point 1, but +1, but still below the total vaginal length -2, which is 6. So we will, regarding the posterior wall, we will final diagnosis depend upon the leading point. So the leading point here is BB. So the stage of the prolapse of the posterior wall will be stage 3. Coming to point C, which is -6, equal to the minus total vaginal length -2. So it is in normal position. Genital hiatus 4.5. The normal is between 2 to 3 cm, which means it is wide. And the perineal body is 1. The normal is between 3 to 5. And here the minimum is 3, so it is considered as weak perineal body. So the final diagnosis will be posterior vaginal wall prolapse, stage 3. And here is the detailed answer. Second example, here in the Popq we find The anterior points A and BA represent the anterior wall at stage at point 0 at the hymen, which means stage 2 between -1 to +1. And the genital and the posterior wall points A, B, and BB -3 above the hymen, which means stage 0. Then genital hiatus is 4, which means wide introitus, and perineal body is 3, which is the normal between 3 to 5, which is considered like adequate. And point C and D is above the total vaginal length -2, which is -6, and it means normal position of the cervix and the fornix, and no uterine prolapse, no apical compartment prolapse. Total vaginal length here is 8, which is considered normal, and the final diagnosis will be anterior wall stage 2 prolapse.